Okay, so we're here with Jessica today. Jessica's ski pole hit her in the head, right? Her ski pole jumped up, and frankly, today it's kind of obvious that your nose looks like it was just pushed over to the side, doesn't it?
Yeah.
I think as the swelling goes down, the curvature gets worse because the swelling was kind of filling in that side a little bit, right? Now you got big black eyes too.
Yeah,
okay.
Nice yellow and purple.
So we're going to straighten you out again. We're going to take another ski pole and put one on the other side and straighten it out. So are you excited?
Yeah, looking forward to recovery, I think.
Okay. Well, what had happened to you exactly? You were feeling in Mammoth?
Yeah, I was coming off a jump, and then I landed on my feet, and I think I smacked my head into my pole when I landed, so it just all in here got a lot of impact from the end of my ski pole.
Okay, a lot of impact. Cool. Okay. So we're going to fix Jessica's nose here from where it got bashed in here. We're going to elevate the depressed bone, but we're actually probably going to fix both sides so that it comes out even. And when we straighten her septum out, it will straighten this all out. So today it's looking really bashed over. As the swelling goes down, it flattens out even more. Fun. So Jessica's doing great. We've straightened out the inside of her nose. You can actually see her nose has even gotten straighter already, magically. But we want to straighten out her breathing and her sinuses, and then we're ready for the part where we actually do the funky bone work for her.
It's recording.
Okay, so we're getting to my favorite part here. I'm going to tap, tap. I can actually feel the fractured bone fragment. Tap, tap. Tap, tap. Tap, tap. Tap, tap. Tap, tap. Good. Okay. And those were the fractures at the top of the nose. Then we do the fractures at the bottom of the nose. Tap, tap. 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 Tap, tap.
There.
Tap, tap. Tap, tap. Tap, tap. Tap, tap. Thank you. So not much. So we've straightened the inside and outside of her nose. The blood has barely made it again to the suction tank as usual. There's minimal bleeding. And I'm delighted here with my results. She's going to get a beautiful airway. The inside's going to be straight, and that's going to keep the outside from being crooked, so the outside will heal nice and straight. They both heal together in the nose, and she should have a really good airway. We also drained the sinuses. She had what appeared to be some old infection in her sinuses. And we're making her nose just a little smaller so that it lines up and that the fractures are going to be nice and straight, so that I'm going to be very happy for her, because she's going to get what I think is going to be an excellent result that's going to be very balanced for her face. And you'll notice this nice little improvement for her. So, all right, good. Turn it off. So sometimes I use a little filing as a touch-up technique, or to help bring a fragment, loosen up a fragment that's almost loose. I'm not using a filing. Rarely do I use the file as a complete nose job procedure. That's usually for people who aren't comfortable with dealing with all the issues of the nose, and people likewise, they get a semi-procedure and they get a semi-result. So we want to make sure that we get everything done, and again, the filing is just sometimes to smooth out an edge. It doesn't do a nose reduction or a revision rhinoplasty with just a file.
It's on.
Okay. Okay, so we finished up with Jessica. She's still a little drowsy. Remember that she had that black eye on the other side before. So far, I didn't give her any black eyes. So she's doing really great, and she's a little puffy, but she's going to have a major GQ nose. Next time she's out on the slopes, everyone's going to go, wow, where'd you get that nose? And she can say, I got it from my ski pole. You're on. How are you feeling? Not hurt too much? Feel much? No, a little sore? Okay. So you're going to start your pain medicine now would be the best. That way, the most it's going to hurt today is when this numbing stuff wears off, and then
Yeah.
after that, do you remember anything from the procedure? You've got a shiny new nose.
Yeah.
Hooray!
Can't wait for the bandages to come off and see it.
See it for yourself. Okay.
Yeah.
Cool. Okay, we're back with Jessica's The Reality Show. Jessica breaks her nose there. America's famous home videos or something? Is this where we're going to go for it? Okay. As I said, I think you did the wrong stunt on Jackass, maybe, or just a good head plant. You know, I used to have a T-shirt that said "Plant a face in Aspen."
Yeah.
And, yeah, I used to have a T-shirt from there. So anyway, so we're back from the unveiling. I was pointing at how my side of the nose barely got black eyes, whereas Mother Nature's side, where she got broken twice, is still black. So we're waiting to unveil. You know, the bozo no, don't squeeze the wheeze. All that. Okay. So the splint is off. So we're doing pretty good. Kind of a little puffy, a little gooey from the tape there, but it's looking pretty straight and smooth. We're at phase 1. It's only been 3 days, but already it's a little thinner and straighter, and we have more to go. Did it hurt you much, by the way, the whole thing?
Not really, no.
Did you take all your pain pills, or you didn't?
No, I took them that first day, and then by the middle of the night, I stopped.
All right, so we're all set there. Jessica's got all of her drills, and we're getting her nose to shape up there. We've taught her what she needs to do to make sure her nose turns into a expert Beverly Hills nose, and we're going to see her back and let her squeeze the wheeze. It's part of our program. We're a bozo exception. You get to squeeze the wheeze here in the Burres Clinic. Okay.